And then I'm going to share this screen. Share. This is, I think, what they see automatically. I'm going to hold off on sharing it. I'm going to let you all be the focus of the conversation, okay? And then when you're ready, you tell me and I will go and share the screen.
Okay. So thank you everyone for tuning in. We are now live with our Let's Talk About Mental Health segment for May being for mental health. And more than anything, May has been, or Mental Health Month has been a lot more important this year because of all the issues that are surrounding us with the pandemic hitting us and with the transition of going now fully virtual. So thank you all for tuning in. Thank you for sharing the space, and a very, very warm welcome to Dr. Jason Vasquez. I really, really appreciate you taking the time to come on here for us and talk about mental health. I think that more than anything, it's very important to start the conversations about how we can start the journey towards our mental health. So just a quick intro, Dr. Jason Vasquez is our lead psychologist at PCC. Dr. Jason has received his doctorate in counseling psychology from New Mexico State University. He has extensive experience providing brief individual counseling, group counseling, crisis consultation, assessment, outreach and prevention, teaching and training. So thank you so much, Dr. Jason, for being open to have this conversation.
Thank you. It's a pleasure to be here. I'm looking forward to having this conversation with you and hopefully be able to take some questions from folks out there in YouTube land. So I'm looking forward to this.
Awesome. So just a quick brief bio about myself. My name is Jasmine Lopez. I am the student intern for the Office of Student Life, and I am here to actually start elaborate a little bit on my personal mental health journey, which has just started. I recently got a counselor to offer their services via phone because of the transition. So it's going to be about a month now, and I am just starting this journey as well. So it's really, really nice and refreshing to elaborate on what the steps were in order to move forward with this journey. So with that, if we can get the screen share, please. Thank you, Carrie. So once again, this is the Let's Talk Mental Health segment with Dr. Jason Vasquez and myself, Jasmine Lopez. Okay. So this is a brief program overview. We are going to talk about breaking the stigma of mental health, a guide towards navigating our mental health, and identifying individual needs or other determining factors that will lead to diagnosing the root cause, as well as going over a few resources and questions. And I have some memes here or some Instagram pictures here from the Psychology Mom, just talking about a few things that may be on the top of our list right now. And with coronavirus hitting and all the different emotions that also came with this pandemic. And then on the right, we have a list of what mental health is and what mental health isn't. And this is just kind of elaborating on what the stigmas are and how mental health can look very differently for many folks. And so, yeah. And these are some statistics from the National Alliance for Mental Health. 1 in 5 US adults experience mental illness each year. With that, only 41% of the people who experienced a mental disorder or mental disability in the past year received professional care or other services. So many folks aren't really receiving the help they need. And this is a really, really big percentage of the population. So it's almost half of the population that doesn't get help with these mental battles.
So Jasmine, if I can kind of jump in here,
Yeah.
I know that you were talking about the statistics, and that was, these are really good statistics in terms of providing a context for people. But I do want folks to understand that, I think it's a lot more common than even these numbers bear out, especially given all of the stressors associated with this public health crisis that we're all going through. And so I think what we're going to find out is that, behind this epidemic, not only are we finding that this is a health crisis, but it's going to be a mental health crisis as well. And so, because, there's these now generations of people who are going through this shared experience that's traumatic in a number of different ways. And so I think these, just to, I like that caption, "You are not alone." These concerns are very, very common, especially now. So I just wanted to make that comment.
Thank you. And I think that that's a really important aspect in why this conversation needs to happen a lot more. I think there's a lot of myths, stigmas, and even cultural taboos that mental health isn't a vital part of our physical well-being. And so if you can just elaborate a little bit more on that.
Well, even before this pandemic hit, what we knew is that, it was like 1 in 4 college students. It was something around the lines of about 25-30% of college students would be expected to experience a mental health concern during their college years. For a lot of people, mental health concerns, for some people it happens in childhood or happens in adolescence. For others, they may be experiencing their first depressive episode or the first experiences with anxiety during the college years, the 18 to 24, during that range, and sometimes earlier, sometimes later. But for how common it is, folks who come from marginalized communities, it's really hard for us to be able to ask for help, because for many people, they believe that asking for help is a sign of weakness. For some people, going to a mental health clinician, a social worker, it's like asking for a handout. It's very hard to be able to share personal and private information with people that you don't know. And, having been a psychologist now for many years, I know that one of the hardest things to overcome is walking through our doors, to be able to say, hey, I'm hurting right now. I'm suffering right now. I really need some help. And I think there's some strength in being able to ask for help. In many of our communities, we rely on these natural supports, whether it be family, whether it be religion, whether it be friends or coworkers. But sometimes that's not enough. Those are really important resources. But in terms of the technical skill and the training to be able to identify a mental disorder, to be able to develop a treatment plan, and then to also give strategies and recommendations for healing and growth. Sometimes it just takes like a few sessions for people. Sometimes they're in therapy for a longer period of time. But one of the things that I think kind of holds people back from seeking services is the perceived cost of it. whether that be a financial cost or the emotional cost. Sometimes people believe that if I go to therapy, if I go seek mental health services, they're going to change my personality, they're going to change who I am. They're going to tell my business out on the street. You know, the goal of therapy, the goal of mental health services is not to change you fundamentally as a person. It's to help you achieve your own goals and growth, orientate yourself towards growth. And that we're not there to change your personality. We're there to help you grow. And sometimes in that growth, it's making significant changes in the way that you see the world, in the way that you interact with others, the way that you even view yourself. And sometimes it treating traumatic wounds from the past and being able to heal. I think other stigmas around mental health are connected to medication, that, you know, if I go see a therapist, they're going to refer me for psychiatric services or going to try to hospitalize me. And those, you know, those are not common experiences. Those are not common occurrences. When we were, you know, open for face-to-face appointments on campus, you know, part of our process was to be able to have a initial conversation with somebody about what would be best for you right now. You know, and it's really important to kind of destigmatize what this is and what it isn't. So, you know, therapy is like having a long conversation over a period of time with one person, versus, you know, I'm going to be in therapy for the rest of my life. Sometimes it's you know, it's a few, like I said, sometimes it's a few sessions, and sometimes it can be over the course of time. Mental health practitioners are bound by confidentiality. And so what's talked about in session stays in session. Of course, there's some limits to that. There's some legal obligations that we have around harm to self, harm to others, things of that nature. But the reality is we want to create a safe space, a space where you can feel like you trust the person that you're working with, and that you're able to talk about the things that are meaningful to you, and that, you know, if you go to a college counseling center, you know, you can expect to, you know, work on a wide range of concerns. You don't have to be in crisis to receive our services. You know, sometimes it could be a career issue. Sometimes it could be an interpersonal issue. Sometimes it could be an emotional concern. Or sometimes we just don't want to feel as alone and want to be able to talk to somebody on a real level, on a personal level, about the things that we're struggling with. Because that's what it's all about, is to be able to share this experience. And I think it's very powerful, and it can be very healing and life-changing for people. I've seen it happen over and over again.
That's awesome. Thank you for sharing that. I also think that this is a powerful relationship that we build with our therapist or our counselor.
Mm-hmm.
Not only are they a professional, but they're also someone that we're connecting with on that interpersonal level, right?
Mm-hmm.
And so with that, I would like to ask, like, what kind of questions should we be asking ourselves when we are seeking a professional help?
So, Jasmine, first and foremost, I think it's going in and kind of mentally preparing yourself for what this is and what it isn't. So, yes, this is going to be somebody that I can, hopefully that I can trust. So, can I trust this person? I think that's like super important. Can I trust them? Are they knowledgeable about the things that I'm struggling with? So, you know, have they had experience treating, you know, if you've been struggling with depression or anxiety or PTSD, whatever it is that you've been dealing with, do they have experience treating that? I'd want to know that. I'd want to know whether they in terms of cultural competence, do they have an understanding of some of the common experiences that, that I identify with? I'd want to know that. I'd want to know about whether that they're even available to take new clients. Oftentimes what I talk about with people, if I'm going to refer them to an outside agency, is about your insurance coverage. First and foremost, we want to know if we're going to be able to pay for this, and a lot of agencies in the community have what's called a sliding scale. So what that means is they may have a set fee per session, but they may adjust that fee based on your financial circumstance. Of course, you often would have to bring some documentation around that, but again, is this affordable? Are they available? Do they have experience? Do they are they culturally competent? Culturally, are they able to be culturally humble? Like, not ask questions if they don't know something. Also, are they somebody that I feel like that I can be honest with? Because sometimes we kind of run that game where we'll go and see somebody, but we'll hold back and not really talk about the things that are important to us, because either we want to be perceived a certain way, or we don't quite trust that person yet. And it's going to take time, because therapy is hard. Sometimes you may come into therapy and feeling a certain way, and at the end of the session, you may feel differently. It may be a sense of relief, and sometimes, over the course of the conversation, it may bring up enough stuff to where you may be leaving the session feeling a mix of emotion, and that's the natural part of the process. So I think it's kind of orientating yourself before you even go through the door, that change is hard. It might be uncomfortable. I might not agree with my therapist, but it's important that you're able to find somebody that you trust and that you believe can help you. Because that's what part of the research says, is that it's really important that you work with somebody that you trust, that you can develop a strong alliance with, and also you believe that they can be helpful for you. Because one of the most powerful protective factors in terms of mental health is hope. And if I can cling on to the hope that I can, things will be better. It means things are difficult right now, but they can be better. They will be better. That can be very powerful, that hope. Very, very powerful. Other considerations. I think also, is it somewhere where I can, I can get to? Because sometimes, people vary in terms of access to transportation. So if you don't have your own personal vehicle, is it close to a bus line that, or am I going to have to do multiple transfers? Is there parking? If you do have a car, I think also availability. So some providers work in that sort of 9 to 5, 8 to 4, traditional business hours, but some actually do work evenings and weekends. And so that's another consideration in terms of availability. So location, availability, the therapist. I would recommend that anybody you work with, that you read their profile, whether it's off of Psychology Today, or whether it's whether that's on their own website. Read what they have to say about themselves. If I'm seeking therapeutic services, I may ask the therapist, can you describe your therapeutic style, like how you work with people? What am I to expect the first few sessions? How will I know things are getting better? Oftentimes what will happen is a therapist will give you a treatment plan, whether it's verbally or actually something in writing, in terms of, well, these are the goals that we agreed to work on, and we're going to work towards that over the course of these next few sessions, and then we'll check back in and see where things are at, because you're a consumer, right? And you have every right to be able to like ask them about their methods, to ask about outcomes. You can ask questions about the process. Okay, I know we talked about trust earlier, but also you can ask questions about, like, I noticed that you recommended this to me. That didn't work, but this did. What else can I do? Things of that nature. I hope I answered your question.
No, absolutely. Yes. Thank you. Thank you for elaborating on that. And then I think the most important thing that I got from this is having the hope and setting the foundation of trust with that person, because it is like it is a relationship that we are going to have. It's probably one of the most important relationships that we are going to have, because that connects back to ourselves and how it's going to impact our progress. So if I believe, like, I am a firm believer that we have to take these first steps, and one of the biggest and most important steps is creating that trust and trusting yourself and trusting that person with these very intimate topics about ourselves.
Oh, absolutely. And that's something that kind of came to mind as you were talking, was that at times, we may need to ask ourselves, how do you trust that person?
Right.
What are some indicators of trust for me? And it's different for everybody. I think it's different for everybody. And what I call a therapy, it's a very unique relationship in terms of therapy, because you basically tell a lot of your personal details to your therapist, and typically you don't know much about that person. You know about their responses to you. And I think that there's some benefit to that, because you are able to, kind of focus on your stuff, the things that are relevant to you. But therapists and mental health practitioners are human too. We all have stuff, right? And so I think it's almost like it's a professional personal relationship is kind of how I might characterize it.
Yeah, absolutely. And since you talked about how all our needs are different, right? I do want to talk about this next slide here, identifying the treatment that's right for you, establishing the questions that you want to ask this provider, but also knowing where to begin to ask for help. And I think we've talked about that, and that's probably the most important step towards this journey. But also knowing what tools we have available, right? And I know you introduced me to this screening tool on the MHA National Alliance organization. And I was wondering if you can tell us a little bit more about that. What does that look like, and what tools are provided?
Well, I think there's some benefits sometimes, if you are wondering about your own mental health, to sometimes do a little bit of self-assessment in terms of how am I doing. So oftentimes what I've found in my experience working in college counseling centers for many years is people will take an online mental health screening to kind of get a sense whether this is something that I may need to get some professional help for. So whether it's screening for depression or anxiety. So oftentimes people will do an online search and look at screening tools around, well, am I depressed, or is this just something that maybe I'm just having the blues right now? And I'm certainly not advocating for anybody to self-diagnose themselves, but to really just be aware of your symptoms. Just because one of the things that's going to happen if you do decide to go and seek professional help, is they're going to ask you typically in the initial sessions about what constellation of symptoms that you've been experiencing. So it's important to kind of have that language for ourselves in terms of, well, okay, I've been noticing that I've been having a hard time with sleeping, with appetite, with motivation. I've had a really difficult time just, seeing some of the positives in my life. Then you're kind of flavoring more towards this might be a depressive episode. This could be, who knows? Like, we need to do more investigation around this, right? So I think that's really important to kind of get an understanding of what you may be going through. I think that's important. So it's not an idea of self-diagnosing, but it's having the language and the understanding of what am I experiencing? Because sometimes what happens for people is they may think, well, I'm just an anxious person. That I've heard that over and over. People describe themselves in that way. Okay, well, what does that mean to you, though? And so being able to have that discussion with your therapist, I think, could be of real value. So I think it's kind of know thyself sort of thing. So just being able to be aware, and also, just like you say on that slide, this is hard. That seeking professional help for mental health concerns or life concerns is not easy. It's not easy. Sometimes it's what I call a leap of faith. That sometimes you've got to kind of take that leap of faith and trust the process. And for some people, they feel better right away. For some people, they feel worse before they get better. And for others, it may take a long time to see some meaningful change. Everybody has their own path. Like, people are different. So yeah, I would say, having those expectations before you even start looking for a therapist, it's also kind of having an understanding of, how long, what kind of symptoms have I been experiencing, and for how long, and how has that impacted me?
Yeah, definitely having that self-talk and
Mm-hmm.
and having that like good self-talk with ourselves is a big part of this process. So I myself consider this task very challenging at times, because sometimes we aren't self-aware of these issues that are going on until we really have that self-talk and have knowing the tools that we have available. And
Mm-hmm.
I think as a Pasadena City College student, we also have a big advantage that we have
Mm-hmm.
our personal counseling, right? And
Mm-hmm.
it's within our student services. So if you could just briefly talk
For sure.
about the services that we offer,
Absolutely.
and I mean, we have the contact information there. But.
Yeah, for sure. I mean, as campus has moved to remote teaching and learning, so has student services has moved to more of a remote format. And so right now, so I can talk about what we did before COVID, and now what we're doing, during this pandemic. But let me tell you a little bit about what services we're offering now. I think that's more relevant. Right now, if you call that number that's listed on the screen, the 626-585-7273 number, and you leave a message with your name, your student ID number, and a callback number, a member of our staff will call you back to arrange a phone triage appointment. And basically, these appointments are brief in nature. They tend to be anywhere from 25 to 30 minutes in length. Sometimes they may be longer depending on the complexity of the student's concerns. But basically, these phone calls are aimed at trying to clarify what concerns students are coming in with, and to be able to provide some like strategies, some coping strategies, and to also help develop a plan for how you're going to manage, your concerns moving forward. And so it's a very collaborative process, and it's also active, because it's not therapy. These are brief telephone contacts. We want to make sure that people are safe. We also want to make sure that we can help people navigate these bumpy roads right now, because this is a difficult time, and so we're providing these telephone triage appointments. In the past, when we've done face-to-face services, we've had walk-in appointments throughout the day. And these walk-ins are very similar to our telephone triage appointments. But we also had therapy appointments, which were basically 1-hour appointments with one of our clinicians. And typically, if you saw somebody for the first time, you would see that person on an ongoing basis. In terms of eligibility for our services, you have to be enrolled in at least one course. You have to be a current PCC student in order to utilize our services. And part of that is just the way our funding is set up. So we see current PCC students, and before, our services were time limited. So when we're doing face-to-face contacts, the therapy appointments, you got up to 8 sessions per semester, and up to 6 during the intersessions. The intersessions are winter and summer. But these telephone triage appointments, we don't have session limits right now. We're trying to make the services accessible for those who need it, and to be able to kind of meet people where they're at. The idea here, though, is that if you're not a current PCC student, but you've utilized our services in the past, and you want to check in with somebody so you can get referral information for a provider in the community, we'll do a courtesy session for somebody, a courtesy telephone appointment. So we really want to help folks. But, typically, in terms of eligibility for our services, you have to be a current PCC student. In the past, we've had assessment services. And again, things have changed a little bit because we're no longer doing the face-to-face because of the pandemic and the campus closure. And so now what we're doing is more of these telephone triage, but then we're also providing other services. So we're doing outreach right now. So kind of typically talks like this or classroom presentations we've done. We also get questions from faculty and staff about how to help students. And so we may do some consultation as well to kind of how to be able to help students, especially students who may be struggling right now. Here's kind of what we know about how people are struggling. People feel more isolated, more worried, more anxious. Sometimes they're dealing with grief or uncertainty about their own health or the health of others that are important to them. The transition to remote learning and has been difficult for some students. It's been a real adjustment. And that's been a stressor for folks. And, being disconnected from social support systems, or not having having their daily routine disrupted, not having their normal routine, I think has been really hard for folks. This has just been a very stressful time, I think for the public in general and our students in particular. So, I think when you talked earlier about like sort of individual needs, this has affected people in very similar ways and also very different ways. And so what we've tried to do is offer services that would be widely available, because not everybody has internet access or stable internet access. So we figured that phones would be more available to folks typically. Okay. And so so that's why we are offering these telephone triage appointments, and then also trying to reach wider audiences by doing these outreach presentations and talks. And so that's kind of mostly what our services look like. Now, you can call that number that's listed there, or you can email us at personalcounseling@pasadena.edu. And again, if you leave your name, your student ID number, and your phone number, somebody will get back with you. Now, what I failed to mention earlier is that they'll call you from blocked number. Okay, and so it's really important if you've kind of left a message for us and you see a blocked number, please try to answer it, because that may be one of us, right? Some people have restrictions on their phones in terms of blocked numbers, and so it's just important to be mindful of that.
Yeah, awesome. Thank you for mentioning that, because I'm actually one of those students that don't answer blocked calls. So thank you for acknowledging that. And
yeah, it's real talk. I don't answer block calls either.
yeah. So thank you for mentioning that, and for talking about what issues that we are all facing in these sensitive times. I think that this crisis has impacted us and our academic journey and our mental health journey across different varieties. So thank you for acknowledging that. And
for sure.
I do want to go on to the next slide. And talk about how students are reacting to the transition of virtual counseling, and how this is actually an article on our Pasadena.edu website that I found very, very, very helpful. And I think that it's really important to highlight all the resources that are available, the updates that we have been having through our platform on the Pasadena website, and talk about a little bit how we can cope with this transition, right? I feel like experiencing a now busier schedule than I did when I was physically on campus is something that I've been facing personally, and I wanted to know a little bit more about this article that we have here.
So just to kind of give you a little bit of background, part of our outreach efforts have been trying to provide information to our students, to our community, about common mental health concerns, so that folks can really, kind of, it could be validating, but also give you some tips in terms of how to navigate moving forward. So our most recent entry was about academic distress and all the different ways in which students might be struggling with this transition. So your question on the slide is about how students have been reacting to virtual counseling. So I will address that for sure. But just to give you a little context behind this article. So if you go to mental health and coronavirus updates on our homepage, it's I think it's like a red, like a button on the right-hand side of our homepage. You'll see it there. And if you click on it, there's a variety of articles on there. So there is an article on the academic distress. There's an article on mood and isolation. There's an article on anxiety. There's an article on oppression and racism. So it's on a variety of topics. In terms of your question about the academic distress article, a lot of it is about some of the barriers and challenges that people have been facing, and what are some of the resources, especially within our PCC community, that can be helpful. So, so in other words, for example, access to reliable Wi-Fi is actually one barrier right now that sometimes people are experiencing. And so we have in the student services, a social worker. Okay, we have somebody who can help. Her name is Susie Herrera, and she can actually help folks get connected to more reliable Wi-Fi. Okay, she's been able to do that. And for faculty and staff out there who may be watching this, you can refer to her through PCC Connect. So availability in terms of Wi-Fi services. I think also the transition to teaching and learning to learning has been a little difficult. We're no longer going to going on physically on campus to classes. And so we've had to kind of rely on these more virtual means. And so that's another, we've talked a little bit about those difficulties and just the importance of being able to also just give yourself some grace, some self-compassion, that this is hard and everybody's trying to kind of navigate it. And you don't have to be perfect at it right now. I think one of the things that you're kind of scrolling through right now is our COVID-19 resources. So we have, if you kind of scroll up a little bit, so there's some resource documents that might be helpful for you, whether it's the tips, there is also parenting resources. We have some videos. And if you can go to our homepage, please, you can click on that. So much appreciated. Oh yeah, it works. Okay, cool. So if you scroll down a little bit, so like there's some mention about so if you could stop right there, about our remote services. But what I wanted to kind of point out to people, if you click on the mental health care package, this is something that we helped we helped develop for our campus community. And so basically this is a digital brochure, and I know it's pretty big, that has a variety of coping strategies on there. Okay. So yeah, if you kind of scroll down a little bit, these are clickable links. And then, so like, for example, these are recommendations of things you can do: starting a blog, calling a friend, writing somebody. Like, can you believe people are now starting to write letters?
I love that.
Yeah, it's really cool. You can do field trips to, a virtual field trip to an art museum. Imagine being able to go to some of the great museums in the world and being able to actually see some of the most magnificent artworks. I think that can be naturally stimulating, intellectually, but also I think just kind of your own, for your soul, to be able to be connected to that. Virtual concerts, recommendations in terms of creativity. So there's a bunch of stuff there. So that's one resource that we want to make sure that people kind of know about. Okay, that we developed especially for our campus community. Free mindfulness exercises, things like that. And so, so one of the things is not only providing the direct service in terms of the telephone triage appointments, but we also want to make sure that we're providing information about these common concerns and then tips on how to navigate. Okay.
Awesome. Yeah, I have looked at this brochure previously, and all of these things are so vital to our wellness at the moment. Taking the time to go out and have a mindful walk, or just catching some fresh air, it goes such a long way. But also, I think knowing that you're not alone, and that many people are going through so many different circumstances, and
for sure.
Yeah.
I saw in the chat box somebody had talked about journaling. I think that can be very healing and for folks as well. There's a variety of coping strategies that I think people have begun pretty creative in terms of whether it's art, whether it's writing. I think this transition to virtual counseling, I think it's been a transition for folks because it's not the traditional face-to-face services. It's over the phone. Actually, we've seen some research actually out there that has shown that people actually are having really positive reactions to phone sessions with their with their providers. I know that it's not as instinctual because we use there's so many modes of communication that we use when we're doing like a more face-to-face interaction. But actually, people have found the phone sessions actually to be very comforting. Hearing that voice on the other end of the line, whether it's a voice of reassurance or just somebody being witness to the things that folks are struggling with. Like I had mentioned earlier, the numerous things that but I think people are being very like resilient and resourceful right now and have found a variety of different ways to cope. I've seen things like Netflix party. I don't know if folks have seen that, where you can, kind of have a running chat with friends and others while watching the same movie, or having virtual gatherings, social gatherings together.
Yeah.
So
Game
people have been
night.
really creative.
Yeah.
Yeah.
Virtual game nights have been something that I look forward to, as well as study sessions with your friends and community members. I think that having that support and
Absolutely.
even a little bit more of accountability, that gives me a little bit more motivation to follow through with my work, with schoolwork and homework and all that stuff. So I think knowing that I have that support has really kept me sane throughout this period and motivated. I think I've broken through the first phase of not feeling motivated and finding a balance now, and knowing that I have a support system that can help me. And I do want to extend that resource to other folks, that your friends need you as well. Like your community needs you, and if you offer that support, there's a lot of people that will take it and that need it in this time. So
For sure. One of the things that I wanted to mention was that, when this first happened, I think a lot of folks were in shock. And it's like it took there was an adjustment period. And so I guess one of the take home points I want to make sure that folks know is it's okay to not feel okay. That sometimes we're not going to feel okay, but it's important, Jasmine, as you were saying, to not isolate yourself, to reach out, to not forget about your self-care. And that's one of the reasons why we had that virtual self-care package, is we want to make sure that it's on people's minds, that you're taking care of yourself. You're getting out of bed every day. You're engaging in those self-grooming activities. You're also eating regular meals, and you're trying to get enough sleep, and that you're making healthy decisions about your body, making healthy decisions about your mind in terms of how much media that you decide to consume every day. Sometimes we need to take a break from the news because it's, it can be very overwhelming, all the statistics and all the news, whether there's going to be a vaccine or no vaccine, or, what phase we are in the stay-at-home order, things like that. It can be very stressful. So making sure we're taking care of ourselves, and then that accountability that you were talking about, making sure that we're checking in with others. One of the practices that I've talked about with people is this idea of, checking in with at least three different people a day. So I know that there was some things on the chat. Did you all catch that?
Yeah. So journaling has helped me in many ways, especially with essay writing. It creates space for me to think clearly. As by Robert Villanueva. Thank you, Robert. And we do have a question from Dean Cobb, and it says, "How do we support students in the light of racism and racist violence? And that seems unending." I have a student saying they cannot think about school because because of feeling attacked and unsafe.
I think it's really important that we acknowledge and we talk about this, that it's part of the conversation. People are hurting right now. People are hurting. I read a quote, and it was by Will Smith. And what he said is that, basically, I'm paraphrasing it, but this is not new. what's new is that it's now filmed. It's like all of us have, you know, or a lot of people have camera phones now, you know, and so it's now being captured and part more visible in the public consciousness. I think one of the things that's really important is that we talk about what our reactions are with somebody you trust. And that it, you know, it's understandable that a lot of us are hurt and we're angry and we're grieving. It's, you know, it's very sad. And so being able to process that with somebody, I think also being able to have allies and connecting with people who you can trust. In us, you know, for some people, it's getting involved in. Some people get involved in social justice movements or volunteering. Some folks try to get involved in their community in some way. You know, I think that's really important to mention that. Like, what can we do to make a difference? Because one of the things that we don't want to do is become apathetic and disengage and isolate, right? We want to be able to move towards some greater good, you know, because you know, we can't give up on this, you know. This is too important. So I think one of the most powerful things that you can do for somebody is to be there and listen and talk about how they're feeling, what they're reacting is. And I'm not telling you to be their therapist or their counselor, but even if you can just listen, even if you can just be an ear for them, that would be something, right? I think finding ways to get involved in making a positive contribution, it's possible. We can do that. Other ideas?
Yeah. So I do know that there are many things going around the world that will make us feel unsafe. And I do want to acknowledge that and commemorate the memory of George Floyd. I know that it's something that is very heavy in my heart personally. And I do want to offer a moment of silence towards everyone that has been a victim of police brutality. Yeah, it's some heavy and very sensitive things that we are going through, but I do want to acknowledge that this does weigh very heavy on on the mental health of the folks that have been marginalized before and that continue to, you know, face these racial issues. I think that you mentioned something very important, that now everything is being filmed, and that's why we are very much aware of everything. But acknowledging everything that is happening does carry that power in it. So thank you, Dean Cobb, and thank you, Carrie, for giving us the space to honor that as well during this talk.
I think it's giving voice to it and being able to talk about it, like, you know, in public, not only in private, but also in public spaces, and to be able to have it be, it's like visible. I think that's a part of it. And the reality is that, you know, part of the healing is through sharing. I think also part of the healing is through involvement, whether, you know, if we kind of distill it down to like just the PCC community, how can you get involved in a positive way to make a difference? Whether it's, you know, if you're a student, whether it's running for office, whether, you know, you're a faculty or staff member, it's getting involved in, you know, in different ways in terms of shared governance. I mean, you know, it's how can you get involved in a way to make a positive difference? I think that's part of it. But again, that public and private sharing and being able to get involved, I think these are not like, you know, it's not the solution to this historic trauma that we've all experienced, but maybe there's some ways forward.
Right. And you mentioned the word trauma, and I think with that we can definitely circle back to this conversation and say that this is why it's important to have these open dialogues and include all these voices and include all the different oppressions that we face, you know, and whether it's virtually or through social media or personally. I think it's really important to acknowledge that and talk about it. I know that like as Robert mentioned, I write a lot about these things and the way it has impacted me, and how I can move forward with the things that I'm involved with and still acknowledge these factors, right? And with that, I do want to move forward to the next slide and talk about other resources that we have accessible as well on the pasadena.edu website. We have resources for folks that may be uninsured or need a sliding scale. We do have these resources that I pulled up from the website. If anyone needs these resources for their community or for their loved ones, friends, yeah, we have these resources. And most of these resources are clinics within Pasadena, but we also have resources throughout different different cities and services, as well as a 24-hour hotline. If anyone feels like they need to just talk to someone or just have someone to listen to them, I think that this is really important, especially during these times, these really sensitive times that we need just someone to listen, right? So thank you for having this this guide on our website, and I think.
Yeah, and actually, if you go to our website, also, and Carrie, you might be able to also get this to post on Instagram and Facebook. We have a list of resources as well, so you can pull that, and it includes hotlines and warm lines. So if you go to the remote services, more about our remote services, and then you scroll down. Yeah, it's coming. So if you scroll a little bit down, so right there, like it's sort of like at the end where it says, yeah, that's it. And magically there it is. So we have sort of a variety of resources there, whether that be emergency hotlines, warm lines, food pantries, shelters, low-cost services, and this is for LA County and the surrounding areas. And so we have also like distilled in the list for Medi-Cal only, so sliding scale fees. So there's a bunch of mental health resources there. And we made it 508 compliant too. So, and I think, Carrie, you can probably save that. I think there's a way that you can probably either download it or you can just copy the URL and put it in a post or whatnot. So, so I would just want to make sure that you, in addition, y'all have that too. I know that I know we're almost out of time, but I saw in the chat, there was a sort of a mention about not feeling safe, and I think that we're just talking about not only the pandemic, but also like in terms of oppression and marginalization, and I think that's a really natural reaction that a lot of folks are having right now. Okay, because there's a lot of uncertainty, and then there's this the pain of these oppressive events that are happening in this country. But it's important that we don't lose faith, and that we're able to utilize our support networks and our allies, and that you're not alone. It's really important that if you need help, that you reach out for it, that you don't let that be an obstacle or a barrier. If anything that you get from this, that you understand that it's okay to ask for help and that you're not alone.
Absolutely. Thank you so much, Dr. Vasquez, again for your time. I really, really appreciate this conversation and all the amazing resources that we have to offer to PCC students and throughout the communities surrounding LA County. I think that's really important. And we do have another segment tomorrow, and it is related to mental health as well. We have some breathing exercises and meditation with one of our former students. Her name is Sam. So with that, I think that that's a really good way of transitioning from, like seeking to ask for help to having tools to actually move forward with therapy and with self meditating and setting the foundation for wellness and healing.
For sure. And if I can just mention that on Tuesdays and Thursdays, we have a coffee chat with a psychologist that we're hosting on Zoom. And so that's an event Tuesdays and Thursdays from 10 to 11.
Awesome.
And so,
well, can we find more about this through the PCC Health Wellness Instagram?
Yeah, it's actually on the. I think that they posted that. If not, I can send you and Carrie that. I don't have the Zoom ID off the top of my head, but I can send you that, and it has the URL that's
awesome.
that's
So
clickable.
I'll be sure to share it throughout our platforms. Our platform is at pcc.osl, and yeah, I'll be sure to promote that. I think that's a great way to continue this journey, right? And continue this conversation. So thank you so much, Dr. Vasquez. It's been an honor and a pleasure to have this conversation with you and to connect with you.
Thank you.
Thank you.
Take care.
Okay.
Bye. Thank you, Dean Cobb.